You know, there is a very specific, visceral type of anxiety that kicks in the exact moment you get injured at work.
Oh, absolutely.
It's not just the physical pain of the accident.
Right.
It's this immediate sinking realization in the pit of your stomach that you are about to enter the system.
The bureaucratic labyrinth.
Exactly. And let's be honest about the story we all tell ourselves, the cultural narrative that is practically, I mean, it's embedded in our DNA.
Right. The default setting.
Yeah. The story goes that this system is an adversarial battlefield. You are the vulnerable David, and the insurance carrier is the greedy, monolithic Goliath. And the assumption, the default setting in our brains, is that they are going to deny you. They're going to delay you, and they are going to starve you out just to save a quarterly decimal point.
It's the deny first myth.
Right.
The idea that the insurance industry's entire business model is predicated on finding fraudulent reasons to just say no.
Yeah.
And that you inevitably need to lawyer up just to get the absolute basics of what you're owed.
Precisely. I mean, it's the plot of a dozen movies and, frankly, the script of about 1,000 daytime TV commercials.
Call us today.
Exactly. Did the big bad corporation use fraud to deny your rights? Call us.
Right.
But here's the thing, and this is why I love doing these deep dives. We have a stack of documents here today that suggests that entire story might actually be, well, mostly fiction.
Or at the very least, statistically, it is the exception and definitely not the rule.
Right. So today we are digging into the 2025 annual report from the New York State Workers' Compensation Board.
A very illuminating read.
It really is. And the mission for you today is pretty simple. We are going to stress test that denial narrative against the actual hard data from 2025.
Because the data tells a very different story.
It does. Because when I first looked at this, I'll be honest, I was skeptical. I assumed the numbers would show a war zone.
And instead, what you found was a surprisingly well-oiled machine.
Yeah.
And I think before we get into the controversy, or rather the lack thereof, we need to set the stage of just how big this machine actually is.
Okay, lay it out for us.
We are talking about a program that deals with about $9 billion annually.
$9 billion.
Yes, it is a massive safety net.
So let's unpack this. If we're going to bust some myths here, we need to know what the reality looks like. What is the actual landscape of injuries in New York State as of 2025?
So let's start with the sheer volume. In 2025, the board assembled 161,264 complete claims.
Okay, over 160,000.
Right. Now, that is a huge number of people, but context is key here.
Yeah.
That number has actually dropped slightly for the second straight year.
Oh, really?
Yeah, we saw a surge post-2020 for obvious reasons, but now things are finally leveling off.
Okay, 161,000 claims. And just so we're clear for everyone listening, because I think people assume any workplace gripe is a claim, what exactly makes a claim complete? Is that just me calling my boss and saying, ouch, my back?
Not quite. For the board to count it as a complete claim, two specific things have to happen.
Okay.
First, they need a formal notice of the injury from the insurer. And second, they need a qualifying medical document.
Yeah.
So a doctor has to be involved.
Got it.
There is a paper trail, or rather a digital trail established. These aren't just minor bumps. These are documented medical events.
Right, digital. We'll get to the tech stuff later because that's fascinating. But looking at these 161,000 claims, who is actually getting hurt? Because I always picture, I don't know, construction sites, high steel, or factory floors with sparks flying.
And those are certainly part of it, but they aren't number one.
No.
No, the top sector driving these numbers in 2025 was healthcare and social assistance.
Wow. The people taking care of us are the ones getting hurt the most.
It's a trend we've seen for a while now.
Yeah.
Think about it. Nurses, orderlies, home health aides.
Yeah, that makes sense.
It is intensely physically demanding work. It often involves lifting patients who are dead weight or struggling.
Right.
So following healthcare, you have public administration, so government workers, and then transportation and warehousing.
Okay. Transportation and warehousing makes total sense with how much we order online these days. That's the Amazon effect, right?
Exactly. Delivery drivers, logistics, moving boxes at incredible speed.
Yep.
And just to touch on the demographics quickly, it's roughly 58% male and 40.7% female.
Okay.
So there is a gender gap, likely driven by the types of industries that have higher physical risk, like construction or transport, but it's not exclusively a male issue by any means.
Right, so we have the scale. Over 160,000 people entering the system. Now let's get to the juicy part. The smoking gun.
Or rather, the lack of one.
Exactly, because this is where the narrative we started with, the evil carrier denying everything, either stands up or totally falls apart.
This is absolutely the core of the 2025 report. If you talk to certain trial lawyers or watch those commercials we mentioned, you'd think the controversy rate was 40%.
Right, maybe 50%.
Exactly. You'd think it's a coin flip whether you get covered at all.
The pitch is essentially, the system is rigged to reject you, so you need us to fight the fraud.
Yes. But the data tells a completely different story. In 2025, the controversy rate was only 9.7%.
Wait, hold on. 9.7%. I want to sit with that for a second because that number feels incredibly low compared to the rhetoric.
It is less than 1 in 10.
So let me do the math here. And I was an English major, so bear with me. That means 90.3% of claims were not disputed.
Correct. 90.3% of the time, the employer or the insurance carrier said, yes, this happened. Yes, we're covering it.
Wow.
And the claim proceeded without a fight.
That is staggering. It completely flips the script.
It does.
It means the system is rigged to deny you narrative is just statistically unsupported.
And what's even more fascinating is that this isn't a fluke year. The trend is actually moving in the favor of the worker.
Really?
Yeah, if we look back at 2020, the controversy rate was 11.9%. In 2024, it was 10.8%.
Okay.
And now in 2025, we've broken below the 10% barrier to 9.7%. The system is becoming less adversarial over time.
That is wild, but I have to play devil's advocate here.
Go ahead.
We need to be careful with our terms. When the report says controverted, what exactly does that mean? Are they just hiding the denial somewhere else?
That's a fair question.
Like, is there a soft no that doesn't show up in the stats?
No, the definition is very strict and legal. A claim is controverted if the carrier files a specific form. The notice that right to compensation is controverted.
Okay.
They have to formally raise their hand, put it in writing, and say, we dispute this claim, even though there is medical documentation on file.
Right.
And they are doing that less than 10% of the time.
So for the vast, vast majority of people listening who might be worried about this, if you get hurt, the system basically acts as a safety net exactly as it's intended.
Exactly.
It's a no-fault system, and the data proves it actually works like one.
Precisely. The drama makes for good headlines and very effective lawyer advertising, but the reality is that the bureaucracy is quietly working for the majority.
Speaking of quietly working, let's talk about speed. Because you can accept a claim, but then drag your feet on writing the check, right?
Oh, absolutely.
That's the other part of the evil corporation trope. Sure, we'll pay you eventually. Maybe next quarter.
We check that too. This falls under what the board calls timeliness of first payment. It's essentially the happy path metric.
How does it look?
In 2025, 9 out of 10 injured workers, 90% exactly, received their first benefit payment on time.
Define on time for me. Because on time to a massive corporation might mean something very different than on time to a guy with rent due.
The benchmark is strictly defined. It's within 18 days of the disability event or 10 days of the employer being notified, whichever is later.
Okay, so less than 3 weeks. And 90% hit that mark.
Yes. And this is significant because it's the 9th straight year the system has hit that 90% benchmark.
9th straight year.
Consistency is key here. It shows that prompt payment isn't an accident. It's a systemic expectation. If you get hurt, the machine is programmed to pay you quickly.
That is impressive reliability, but there's another side to payment stopping it. I saw a stat in here about suspensions. That sounds negative. Is that where they cut you off arbitrarily?
It sounds negative, but it's actually about following the rules of recovery.
Okay.
When a worker gets better and goes back to work, the wage replacement payments stop. That's just how it works.
Sure.
But the carrier has to file paperwork to say, we are stopping payments now because he's back at work.
Right.
If they don't file that timely, it creates confusion and overpayments. In 2025, 93.6% of those suspension transactions were filed on time.
Wow.
That is the highest recorded number ever.
So even when they are cutting off the money because you're better, they are doing paperwork correctly and quickly, it really does sound boringly efficient.
In the world of insurance and injury, boringly efficient is the highest compliment you can give.
That's true.
You don't want excitement when you're waiting for a check. You want boring.
Fair point. Now, I want to touch on how these things get resolved, because there are nearly 500,000 resolution events in a year.
That's right.
That's a massive amount of decision-making. They can't all be going to court with a judge and a gavel.
They aren't. And this is another efficiency win that gets overlooked. 64.5% of resolutions happen through informal methods.
Informal methods? That sounds like a handshake deal in the hallway. Or worse, a backroom deal.
It's a bit more structured than that. It involves things like administrative determinations and conciliation.
Okay.
Basically, a claims examiner at the board reviews the file, looks at the law, proposes the decision, and sends it to both parties. They say, given the facts here, is the fair outcome.
And do people agree, or do they fight it?
Overwhelmingly, they agree.
Yeah.
88.8% of these proposed informal decisions are accepted by the parties.
Wow. So nearly 90% of the time the board says, here's the fair outcome, and everyone, worker and insurer says, sounds good.
Exactly. It saves time, it saves legal fees, and it keeps the system moving. It clears the deck so that the judges can focus on the cases that actually need a complex legal review.
Okay, let's pivot to those complex cases. Because even with a 9.7% controversy rate, 9.7% of 160,000 is still, well, it's about 16,000 people.
It is.
That's a sold-out basketball arena of people who are having to fight.
Yes. And even valid claims have hearings sometimes. Just to settle details, in 2025, there were 244,714 hearings held.
Wow.
That's actually up about 5,000 from the previous year.
So the volume of hearings is up. Is that clogging the system? Are people waiting months to see a judge? Because justice delayed is justice denied, as they say.
That's the incredible part. Despite the volume going up, the speed has increased dramatically.
Really?
The average time to schedule a hearing is now 35 to 37 days from the request.
35 days? How does that compare to before?
It is 50% faster than just 1 year ago in 2024.
Yeah, they cut it in half.
They've literally cut the wait time in half in a single year. And for those controverted claims we talked about, that 9.7%, the median time to schedule a pre-hearing conference is just 25 days.
That is massive. If you are that injured worker waiting for a decision on your surgery or your lost wages, waiting 1 month versus 2 months is a lifetime.
Absolutely.
How do they pull that off?
Modernization. And specifically, the shift to virtual hearings.
I assume this means we aren't all driving to a dusty courtroom in Albany anymore.
No, the vast majority are remote. The virtual hearing system is fully entrenched now. It's the standard.
That makes sense.
Which also helps with that speed and accessibility. You don't have to drive 3 hours while injured to sit in a waiting room.
It seems like technology is the silent hero in this report. Which brings us to modernization. We mentioned earlier that the paper trail is digital now.
Yes.
Tell me about this OnBoard system I keep reading about.
OnBoard is their massive digital platform. It's the brain of the operation. In 2025, it received over 8 million documents.
8 million.
Now, interestingly, that's down about 1 million documents from the prior year.
Wait, less paperwork. I thought bureaucracy only grew. How is efficiency up if document volume is down?
Well, digital processing consolidates things. You don't need 3 copies of the same form anymore.
I see.
And a big driver of this in 2025 was the launch of e-forms for attorneys. This launched late in 2024, but we really saw the impact in 25.
How does that change things?
Attorneys can now submit data directly into the system fields rather than uploading PDFs that someone has to read and type in.
Oh, that is huge.
It sounds small, but it leads to better data quality. That 50% improvement in hearing scheduling speed. You can trace a lot of that back to the efficiencies gained from OnBoard and e-forms. Better data and faster decisions out.
I love it when a plan comes together, but the report isn't just about processing speed. It also mentions some changing rights.
It does.
The board isn't just a calculator. They determine what counts as an injury, and they are actually expanding what counts as compensable, right?
They are. This is where we see the system adapting to the modern world. There were 3 big changes highlighted.
Okay, let's hear them.
First, there was a significant new law implemented regarding stress claims.
Stress claims, like my boss is shouting at me, because historically a workers' comp is for broken bones or bad backs. Stress feels a bit nebulous.
It was historically very hard to claim. But this new law allows claims for extraordinary work-related stress.
Define extraordinary.
It has to be significant more than just a bad day at the office. But the fact that the legislation explicitly creates a lane for mental health claims is a huge cultural shift.
It is.
It acknowledges that a workplace injury isn't always visible on an X-ray.
That is a big step. And I saw something about doctors, too.
Yes, another legislative change now allows resident and fellow physicians to treat injured workers.
Why does that matter? A doctor is a doctor, right?
Previously, the rules are restrictive. You often had to wait to see the fully boarded attending physician.
Oh, I see.
By allowing residents and fellows who are doctors undergoing advanced specialization to treat these patients, you expand the pool of available providers.
It's a supply and demand fix.
Exactly. It means you get an appointment faster.
Makes total sense. Now, I want to talk about one specific regulation that caught my eye because it feels like it has some serious teeth.
Let me guess the pharmacy rule.
Yes, the non-network pharmacy regulation. This is a fascinating bit of consumer protection.
It really is.
So unpack this for me. Usually insurance says you must go to CVS or you must go to Walgreens, right? You are locked into their network.
Correct. They have a network to control costs.
Yeah.
But what happens if you go to the network pharmacy? You're in pain, you need your meds, and they fail to dispense it.
Right.
Maybe they don't have it in stock, or there's a glitch in the approval system.
You're usually stuck paying cash or going home empty-handed and hurting.
Not anymore. This regulation says if the network pharmacy fails to dispense, the injured worker can go out of network to get their meds immediately.
Okay, that's good. But usually out-of-network means you pay for it or the insurance fights the bill later.
Here is the kicker. If that medication is later found to be compensable, meaning it was a valid prescription for the injury, the insurance company gets hit with a significant payment surcharge.
Well, I like that. A surcharge, a fine.
It's a financial incentive. It basically tells the carriers, get your network in order. If your system fails and the worker has to go elsewhere, it's going to cost you extra.
That's brilliant.
It incentivizes them to make sure the worker gets their meds fast the first time.
See, that detail really strikes me. It shows a board that isn't just stamping forms, but is actually looking at the friction points for the human being at the center of this.
Exactly.
And trying to smooth them out using the only language carriers understand money.
It connects back to that theme of efficiency we discussed earlier. Efficiency isn't just about speed for the sake of speed. It's about removing barriers to recovery.
So let's bring this all back together. We started this deep dive with the evil corporation narrative. The idea that you have to fight tooth and nail for every dime, and that fraud is rampant in the denial process.
And we found that the 2025 annual report paints a radically different picture.
It really does.
We have a system that is faster than ever. It's more digital than ever. And crucially, it is statistically less adversarial than popular lore suggests.
That 9.7% controversy rate really is the headline for me. When you strip away the anecdotes and the lawyer commercials, 90.3% of claims just flow. They work.
And that is the metric that matters most. Look, every denied claim is a personal crisis for that specific worker. We aren't minimizing that.
No, of course not.
If you are in that 9.7% at food, the system feels very different. But if we take this systemic view, the view of the $9 billion program, the no-fault pipeline is flowing exactly as designed for the vast majority of people.
Right.
The fraud narrative simply isn't supported by the math.
It raises a really provocative question to end on, though, for everyone listening.
What's that?
If the data proves that 90% of claims are not controverted and payment timeliness is also at 90%, why does that narrative of the greedy denying carrier persist so strongly? Why do we still believe it?
That's the real question. Is it just a holdover from a different era decades ago? Or is it a necessary story?
What do you mean necessary?
Well, think about it. Does the litigation industry, the lawyers, the massive ad budgets need that villain to keep their own wheels turning?
Wow. If there's no you don't need to hire a dragon slayer.
Exactly. If people knew the system worked 90% of the time, maybe they wouldn't rush to call that 1-800 number.
And pay a chunk of their settlement for the privilege.
Right. But the 2025 data suggests that for most people, there is no dragon. Just a process that surprisingly works.
And on that note, we'll leave you to ponder the reality behind rhetoric. Thanks for joining us on this deep dive into the workers' comp board.
Always a pleasure.
We'll see you next time.